Okay, guys, so now let's talk more specifically about that urge incontinence, that urgency. So that feeling of when I need to go right now, right? We know that is an unpleasant sensation. So one of the first things we like to talk about is this idea of urge suppression techniques, a way to suppress that very uncomfortable feeling. It's a bit counterintuitive because I know that when you get that feeling, the first thing you want to do is just tighten everything in your pelvis as tight as you can possibly tighten it. And what the research has found is that actually puts some pressure on the urethra, which can increase that feeling of urgency. And it surprisingly does not seem to have much of an effect on your ability to decrease the risk of actually leaking, which is normally what people are doing that clenching for, is to
trying to avoid that.
try to avoid that. So counterintuitive, I know, but that is not going to be your friend. What they have found that can be very helpful for urge suppression techniques is doing some nice deep breaths. Okay, so bringing down that nervous system as a whole.
Yeah.
You can do some what we call pelvic floor flicks. Okay, so first of all, you need to know that you're contracting the right muscles. But that idea of not turning on that pelvic floor and clenching, but that idea of just kind of flickering it on and off gently, that is going to send a signal to your brain that says, nope, bladder, not your turn. Do not release.
Right.
So doing some of those flicks and then going back into that deep breathing to making sure that you're bringing that pelvic floor back down to a fairly relaxed baseline. One of the other things that has been shown to work is some like mental distraction techniques. Think about anything else, anything but bathrooms and water, right? You can count backwards from 10. You can make a grocery list in your head, but just make sure that you're not breath holding and clenching while you're doing that. And surprisingly, another one that helps for a lot of people is doing some like heel toe taps. So moving your toes and your feet around. When they've done some brain mapping, the area for the feet is very close to the area for the genitalia. So that is why that works, is because when your brain is lighting up, paying attention to what your feet are doing, it kind of overrides that area of your brain that is saying, I think I need to go to the bathroom now. And if you can sit, that's normally a little bit easier. Depending on where you are and what you're doing, you could possibly apply some perineal pressure, so that that perineum is that area of the skin between the vaginal and rectal openings. They have found that if you can do 30 seconds of perineal pressure, that can dramatically decrease urge. That being said, it's depending on where you are. That one's not always super effective, not always super feasible.
Yeah, definitely.
And so what we're trying to do with these urge suppression techniques is, your urgency should have a bit of a curve, right? Where it kind of peaks and then it comes back down. And what we typically see is that people are rushing to the bathroom at that peak of that urgency curve. And that is actually when you are most likely to leak. And also, if you're always rushing to the bathroom at the peak of that urgency curve, that's basically telling your brain and your bladder, like, good, this is good, keep doing this, guys. And that's not what we want. So that's kind of starting to get into some of that bladder training aspect of it. So the urge suppression techniques are used to help with the bladder training. What we're trying to do with bladder training is to get your brain back in charge of your bladder and not the other way around. So one of the first things I have people do for bladder training is to start out by, again, back to that bladder diary that we keep referring to. How often are you actually going to the bathroom? Because we need to know what your baseline is. We need to know where you're starting, to know kind of what are some reasonable goals. Because we're going to do things very differently with someone that's going to the bathroom every 2 hours compared to someone that's going to the bathroom every 30 minutes, compared to someone that, it feels like it's all over the place and random. We're going to look at that a little bit differently. But we never, no matter what, want to be rushing to the bathroom at that height of that urgency curve. So what we want to use is some of those urge suppression techniques. And as that urge comes down, then you can get up and slowly walk to the bathroom.
And that really is key, that slow, calm walk to the bathroom. Like really keep that deep breathing going the whole way.
Mm-hmm.
I know it's going to be hard at first. Like it
Yes.
is a challenging, this is a big habit that we're trying to help your brain achieve. So it does take some practice. And that's where that pelvic floor relaxation again comes in
Mm-hmm.
and is really helpful, because if you're already practicing that nice deep breathing, your brain is already aware of like, oh, hey, when I inhale, my pelvic floor relaxes. When I exhale, it gently contracts. It doesn't have to work quite that hard when we're trying to incorporate it into this new activity with these bladder training techniques.
I always tell people, if you can't do something on with your body on purpose when you're in a nice, calm, relaxed state, you're really going to have a hard time doing it when you're under any sort of stress.
Mm-hmm.
So having that baseline pelvic floor relaxation and awareness and control is going to translate very, very well into some of these urge suppression techniques for sure.
Mm-hmm.
So with bladder training, like we talked about at the beginning, one of our goals is that you're going every 2 to 4 hours. So, let's take the example of someone that they do their bladder diary and they find that in actuality, they're urinating about every hour. So what I will traditionally do with this person is say, okay, you're going to have to pay attention to your clock for a little bit, right? Let's say you get that first urge and you know that you just urinated an hour ago and it's not like you've had a crazy amount of fluids in the last hour. So we're going to say, okay, that's not a very true urge. You're going to do some of these urge suppression techniques and see if you can't get through that urgency curve. Now, depending on how strong this person's urges are, for some people, I will say, okay, once you get through the urgency curve, go ahead and try to go ahead and then go to the bathroom. If it's somebody that can, I'll say, okay, if you can get that urgency curve all the way back down to 0, go about your day. And then when you get that next urge signal, that is when you go to the bathroom. Ideally, we want to kind of try to be slowly, incrementally increasing the time between voids until we get to that goal amount. My goal amount for most people is that 3-hour mark because it's right in the middle between the 2 to 4 hour window. Although I do like to tell people, we didn't get into these bladder habits overnight. It's probably been years of forming these habits. So we got to give ourselves some grace in getting into the good bladder habits. Right. But like any muscle, your bladder is trainable and you can train back into those good bladder habits very successfully with some solid work and effort.
Right. And you want to think about like how to set yourself up for success. Like don't start, your day one of bladder training when you have like crazy work meetings and you have a lot going on. Really think about and be mindful about how you want to start incorporating these strategies into your daily routine so you feel like you are and can be successful with them.
Absolutely.
Because it can be really disheartening. We want you to be successful. But we want to think about what are realistic goals.
Absolutely. Absolutely. And I have some people that just telling them that every time they get the urge doesn't necessarily mean they need to go to the bathroom. And it's like, it just clicks right there and they come back and they see me next week and they're like, I just didn't go to the bathroom every time I got the urge and I feel 1,000 times better. And then I have some people that really have to work hard to train their bodies back into not giving them these really, really strong urge signals.
So another layer with urge incontinence is trigger points.
Absolutely. So with urge and urgency and urge incontinence, statistically, I am more often seeing pelvic floor tension than I am weakness. Because it's not that their pelvic floor is being overcome because it's so weak and that's why they're leaking. A lot of these patients are leaking truly because the brain pelvic floor connection is off and their bladder is purposely squeezing and eliminating and voiding that urine. So it's not necessarily a matter of weakness. Now with trigger points, so a lot of people are familiar with trigger points. A lot of people get them in their upper traps. You can feel them, you can push on them and they're like, oh yeah, there's some tension there. Your pelvic floor is also muscles. You can get trigger points in your pelvic floor. Now, particularly in the muscles that are around or near the urethra. So the urethra is the tube that the urine comes through after it leaves the bladder and to exit the body. If there are trigger points in the muscles around that urethra, your urethra will sense that extra pressure as urgency, because urethras don't typically hurt. That's why even with like UTIs and urethral irritation, people are more likely to complain that they feel like they need to urinate all the time than they are to say, my urethra hurts.
Right.
So with trigger points in those muscles, a lot of times the only symptom of that is this low level urgency, or like this kind of sensation of like, I just kind of always feel like I need to urinate, can be there. And so with this, again, you can see a pelvic rehab specialist. In fact, with any sort of internal manual work, that would be a great recommendation, even if it's just for a visit or two, to get you going on a solid home program, making sure that you're, addressing the right muscles and all of that stuff. That would absolutely be detailed. But if you place a finger directly and vaginally, right at, if you're thinking about your pelvic floor like a clock, so right at the top, or what would be like 12 o'clock on a clock, that's where the tube of the urethra comes down. So you wouldn't want to press directly on that, because that would just not be very comfortable. No. But on either side of that, if there's any sort of tenderness or tension, that could be leading to that urgency. And that is something that you can, in theory, very gently massage or very gently put some pressure to and release that muscular tension. You can do that manually with a finger. They do also sell tools called TheraWands, or pelvic wands. CMT Medical sells one, as does a company called Intimate Rose. They can be found at either one of their websites or Amazon. I mean, these are just becoming much more commonplace things that people have. The idea behind the TheraWands is that it's not particularly easy to reach yourself internally, vaginally. And when the goal is to try to get these muscles to relax and these trigger points to relax, if you're like half crunched up and trying to reach, that's just really not a good position to relax. So the TheraWands or pelvic wands, the goal of them is just quite simply to extend your reach so that you can address those internal trigger points without feeling like you're getting yourself into an awkward position.
And this is something to kind of be aware of. If you've done the urge suppression techniques, if you've done your bladder training and you still feel like you're not achieving your goals, then that's when it would be a good idea to do that internal vaginal exam, either yourself or reaching out to a local pelvic floor therapist. And there are more and more pelvic floor therapists available in the area. So finding one is not as tricky as it used to be.
Thank goodness. Yeah. Thank goodness. We want everyone to be able to find any sort of resources that they want. And if you're having a hard time finding a resource, you can certainly reach out and email us. There are a few pelvic floor directories that are nationwide that are available online.
So in summary, we've talked about a lot of things today. The big one is stress continence and urge incontinence. It's not the same. It's treated differently, but it is very treatable.
Very, very treatable. And this is absolutely something that you can work on at home, that you can work on with like a health coach, that you can work on with a pelvic rehab specialist, but absolutely not something that you want to just accept and be like, oh, well, I guess this is just something I have to deal with now.